The entry of the Indian COVID-19 variant into the country now calls for extra vigilance in the war against the global pandemic. Kagwe says the entry of other variants remain a possibility, even as the ministry undertakes sequencing to establish risk levels and prevent further community spread of the new COVID-19 variant. The health CS was speaking in Nyeri, where he announced that 568 more people had tested positive for COVID-19 over the last 24 hours.
Following the confirmation of the presence of the Indian COVID-19 variant in the country, the Minister of Health is calling for more vigilance and individual responsibility from members of the public. Speaking in Nyeri County, Health Cabinet Secretary Mutahi Kagwe said the entry of variants in any country was inevitable.
That it cannot be business as usual when it comes to COVID-19. As long as there are new variants coming into the country, and they will come to the country, no matter how much effort we put in, there is not a single country, unless you close your borders completely and allow nobody in and nobody out. That is the only way you can be sure. And even then, you never know.
Sentiments echoed by the Director of Public Health, Dr. Francis Kuria, who noted that the new variant spreads faster.
We all know that the variant is more virulent, is more contagious, and is more transmissible. So we are urging all of us, having known that the variant is here with us, to keep that vigilance higher. And as we continue sequencing and continue our surveillance efforts, urging all of us also to take care that we make sure that we don't get this variant circulating in Nyeri, for example, and in the communities.
In the last 24 hours, the country has recorded a 6.3% infection rate following the confirmation of 568 COVID-19 infections from 9,029 samples tested. The latest figures have pushed the total number of caseload to 162,666. Another 15 deaths have been recorded. The 15 deaths having occurred on diverse dates to push the number of fatalities to 2,865. 1,086 patients are currently admitted in hospital, with 131 being in the intensive care unit. To date, 911,515 people have been vaccinated against COVID-19 in the country.
And as there are counties that are slow at distributing and carrying out the vaccination process, because we cannot afford to have the vaccines, because we cannot have the vaccines expire, we must therefore recapture and redistribute in areas that counties are slow at carrying out the exercise.
Nancy Okware, Channel 1 News.